Half a day, we're back from recess. We were experiencing some technical difficulties, and I would like to start with Senator Tadegui. I believe that's where it got cut off. So, Senator Tadegui, you're recognized.
Thank you, Madam Chair. Director Miguel, you mentioned earlier, or even Talling was giving us some numbers, that your revenues that coming into GWA annually is $100 million, and that your operating expense is $80 million in operating expenses. How much do you have in debt that you have to pay back for prior loans that you've taken out? How much is that yearly?
So I think our current annual debt service is around 36 million.
Okay, so 36 million. So you are like, to me, it looks like if you take 80 million that in operating and then you take 36 in loans that you have to pay back, you're in the red of what revenue that you receive annually, about 100,000, 8,765. So
can I just correct my statement?
Sure.
Over the last 5 years, our operating revenues range between about 58 million to about 70 million.
50.
I mean, sorry, operating expenses.
Oh, operating is 58 million?
Yeah. That was the low, and then it went up to about 68.
Okay,
and
so
then this year it's about 70.
Okay, so you're averaging maybe about 65 million, yeah, if you just kind of average it out, right? So that means you have, that's $110 million in expenses. You're operating as well as the loans that you have to pay back, 110, but your revenue coming in is 100 million. And that's why it's kind of, how are you able to get any kind of bond if you're showing in the red in every year?
So her prior statement was around 100 million. I believe in 23 we were at 107, so slightly above, but we have been meeting just minimum debt service coverage at 1.3, and we have to adjust our expenses every year to make sure that we can meet that debt service coverage. Otherwise, we would be in technical default. And
so that means that this new 560 or 580 that you want to borrow now is going to put you even, how much is that annual payment going to be then for the estimated of 5% that you've put in a year? So that's going to add on to that. So basically what we're seeing is that this rate increase is coming up because, well, the rate increase for our customers, GWA, is going to increase so that you can borrow this $560 million every year, which is substantial. Have you ever thought of just, gradually doing this instead of just, bam, all at one time?
As I mentioned, the capital improvement program consists of compliance requirements for the partial consent decree and for complying with PFAS, the new PFAS regulations. Yeah. That schedule is fixed and determined. For the consent decree, it's a 10-year compliance period, and we're spreading the work out over that period, but in order to get it started, we will need some significant funding up front, which is included in this 5-year plan. We have, now that the PFAS regulations have been finalized, we have a very short time frame to get those treatment systems in place within this 5-year period as well. So
I understand
we're spreading
that, but
it out as much as we can.
Isn't that separate, Miguel? I mean, you can work on that part, and then you have all the other stuff, your 5-year plan, including all these replacing of older pipes and leaking. Isn't that incorporated in this too as well, this 5-year plan?
Yes, all of those initiatives are included in the 5-year plan.
Okay, I just think that we can go back to the drawing board to try and, lessen the possibility of a huge rate increase, that's anticipating for this. It's quite substantial. The other question I had is that ARP funding was given to GWA of $8,637,400. What did GWA do with this $8,637,000 that was given to you from ARP funding?
There were 2 pots of ARPA funding that we received. One was used to mitigate rate increases in our prior 5-year plan, and the other tranche of funding was specifically for infrastructure projects, and that is the project that I mentioned is currently ongoing.
Okay, so the 8.6 million was given to you for what? Just the 8.6? Because the 12 million that came in 2024 was 12,400,000. So let's just go to the 8.6 million. What was that used for?
That was for the infrastructure, if I'm not mistaken.
Infrastructure.
$8 million was used for the infrastructure project to expand the wastewater collection system and extend new upsized water lines in the Atacao area. And the 12 million was used specifically to cover operational expenses to mitigate rate increases in the last 5-year plan.
Was any of that 12.4 million given to salary increases?
No,
None?
it was used for operational expenses.
Okay, well, operation expenses also could include that as well. Okay. Other than that, the last question I have is, where on this chart do I see any federal funding that would help mitigate this project, you know, instead of going out to the bond?
On slide 12, the funding sources identified for our 5-year capital improvement program, you could see a table that shows grant funding of 89 million, comprising about 9% of our total CIP.
Okay, 89 million in grant funding. Any other possibilities of any? I know the good author of the legislation was just asking about any other opportunities like US EPA to go after climate change funding for there, but has there been any other opportunity on the federal side, you know, considering that the federal government is utilizing quite a bit of our property outside the fence, you know, and utilizing our wastewater treatment, so anything?
We are constantly exploring all potential federal grants. The opportunity that Senator Perez mentioned, we are pursuing that. We are also pursuing grant opportunities with Department of Interior, Bureau of Reclamation. So yes, we are looking at all of those funding sources, but the ones that we put down here are ones that are programmatic and that we know will be available to us.
You can't get it. Okay. But like DOD, Interior, you talked about Interior. What is the status on those fundings?
As they come up, we apply for them and then we compete for them. So if we get them, they go into this formula, so it reduces the amount of funding we may need to borrow.
And then let's say you get some of the bipartisan infrastructure bill that funding that was given. Would you be able to take that money and be able to pay down the debt?
We use it for projects only. We don't use it to cover the debt service.
So that would still increase the rate, even though you go out for federal funding?
No, it reduces the amount that we would have to finance, and therefore reduces the amount.
Yeah, but if you go out and finance already for the $560 million, and you get that financing, and then it's already tagged every month that you have to pay, that's why I'm asking, would you be able to use that funding to pay down the debt on federal funds, so that you can pay it off?
The federal grant funding that we receive for the bill is included in this
Right,
number,
I understand.
right? And it
Talking
has a
about
condition that it can only be used for capital improvement projects. We cannot use it for debt service, which is an operational expense.
So we still have to pay it off then. So if you get this federal funding later on after you borrowed this money, then you have federal funds to cover the project, but we still have to pay down the 560, and you can't even use that money to cover the cost. Unless you use your revenues that come in, right? The 100 million of revenues that come into GWA, you can use that to pay down the debt, right? And then use the federal money to cover your operating expense. Probably not. No, so we're just stuck.
I think you're missing something. If we get additional grant funding, it reduces the amount. The 560 doesn't become 560. Then it would reduce the amount.
No, I understand, Miguel. But what if we can't get that federal funding until like a year from now, and you've already gone out to the market and you've borrowed that money?
We're not borrowing the 560 all at once. It's spread out
through 5 years.
Over the 5 years and beyond, if we are allowed to use the
So it's broken down.
Paper. Yeah. So there will be a benefit.
Okay. Thank you for clarifying that. Thank you, Madam Chair, for the opportunity.
Thank you, Senator Tadegui. Vice Speaker, do you have any questions at this time?
No, not at this time. Thank you very much, Madam Chair.
All right, so I just want to say that, overall, Bill 274-37 aims to provide GWA the flexibility to obtain the most competitive rates in order to maximize savings, which was also under the guidance of Bond Council and the creation of this bill. It's important to note that GWA intends to look for the lowest interest rates and even to seek grants to help reduce any increases that are needed to fund CIP projects that are mandated by partial consent decree, and also to address the issues of PFAS as well as dildren in order to protect the health of our community. And so what this bill does, it would save the people of the ratepayers of Guam approximately $84 million and upwards to $100 million, which will help greatly support our community. Also, what was contemplated in this bill was not to go out for the full amount, so just the bare minimum of $560 million to pay for the consent decree projects and PFAS and dildren, with the, to promote the initiative to seek grants, to seek low interest loans through the USDA and WIFIA, which are highly competitive. And so, I think in working together and collaborating with this bill, it was definitely the intention to seek the least cost to fund projects that are mandated. So I want to thank all those that came here today to provide testimony, and we all are, looking out for our people in regards to ensuring clean drinking water, and to seek also that GWA is also continues to operate functionally. So thank you again, and we will continue to receive testimony until 4 p.m. May 8th, Wednesday. Actually, that's next week. So please address all testimony to Senator Sabina Flores Perez, Chairperson on the Committee on Environment, Revenue and Taxation, Labor Procurement, Statistics, Research and Planning. It can be dropped off at the mailboxes at the Guam Congress Building or emailed to office@senatorperez.org. If there are no further testimonies or comments on Bill 274-37, this bill is duly heard. Siduos Masi.
Thank you very much, Senator.
Thank you. So at this time, we are running over time, and I believe we're going to jump over to the next bill because we do have people on Zoom in the East Coast, and we're going to move on to Bill 267-COR. We'll come back later to Bill 273. So thank you for GWA for being willing to stay to provide their testimony after this bill. So the next item on our agenda is Bill 267-37-COR, sponsored by Vice Speaker Tina Rose Munoz-Barnes and co-sponsored by Senators Roy A.B. Kanata, Christopher M. Duenas, William A. Parkinson, Jesse A. Lujan, Frank Blas Jr., Joe S. San Augustine, Amanda L. Shelton, Dwayne T.D. San Nicolas. It's an act to add a new section 5126.1 to subarticle C, Article 2, Chapter 5, Title 5, Guam Code Annotated. Get to that page. Relative to authorizing the Division of Public Welfare to join or use contracts of other states, other government procurement units, or not-for-profit entities comprising one or more states or government procurement units. Invitation of today's public hearing was sent to the Director of Public Health and Social Services, Director Peter John Camacho, and I believe we have a representative here, Attorney General of Guam, Douglas Moylan. Fiscal note was received on April 18th. It states that Bill 267 will allow Department of Public Health, Division of Public Welfare to join or use contracts of other states, other government procurement units, or not-for-profit entities comprising of one or more states or government procurement units, as the Department of Public Health has not explicitly been granted authority under the procurement law to leverage and reuse contracts of other states, This addition authorizes DPA, Department of Public Health and Social Services, to enter into a joinder with other entities. Additionally, the contracting officer must verify and provide in writing that the jurisdiction's contract has gone through a competitive procurement process. However, absent information from Department of Public Health relative to the estimated costs or potential savings to join or use a contract of other states' procurement units or not-for-profit entities, the Bureau is unable to determine the fiscal impact. I'd like to recognize Vice Speaker to provide opening remarks. You're welcome and good morning.
Madam Chair, for giving me the opportunity to speak and open on Bills 267-37 COR. Manana Sizuas, Madam Chair, and my colleagues, and a special thank you to our off-island partners who have stayed up late in the evening to attend this hearing virtually. Mr. Gary Smith, who is the Medicaid Director from the U.S. Virgin Islands, from the Department of Human Services. I want to take the time to extend my big thank yous for him staying up and being online for this hearing, to attend this hearing virtually. So I want to also share with you, Madam Speaker, that the reason for the Marmar is just to acknowledge the fact that it's May Harvest Month at the Department of Agriculture, and they wanted to invite all those to, as we look at sustainability for our foods and food security, that they have an event going on right now. Madam Chair, more than 45,000 local residents rely on Medicaid for their health needs. This measure, 267-37, would extend an existing authorization in local law to the Bureau of Healthcare Financing Administration under the Department of Public Health and Social Services. And in order to make their government-backed insurance more reliable, more responsive, and more meaningful. Madam Chair, about 10 years ago, the legislature gave the Bureau of Economic Security, also a part of Department of Public Health and Social Services, the ability to use joinder and or mutual use contracts. The law allowed for the Bureau of Economic Security, which is BES, to successfully implement the EBT system through a competitively bid cooperative procurement since that time. However, based on conversations our office has had with DPHSS staff, the law as it currently stands has some ambiguity on whether the BHCFA itself can leverage existing agreements from other jurisdictions to join contracts for an eligibility and enrollment and Medicaid management information system that will meet the CMS standards. Clarifying the intent of this lawmaking body, which is to save time and money while not sacrificing improvements to DPHSS services and programs, is in line with the advocacy both from our local health department and the Centers for Medicare and Medicaid Services, which is CMS. In fact, the federal government has regulations and rules that allow Medicaid state agencies to reuse agreements from other state agencies, as our local department puts it, in an effort to maximize the impacts of CMS money and expand usage of CMS-approved systems to jurisdictions that either can't afford expensive procurement or don't have local resources available in their areas to take advantage of technology to improve delivery of services to their customers and providers. Enacting this extension will provide a major financial benefit to Guam and our patients. And according to the Department of Public Health and Social Services, using CMS-approved systems will allow Guam Medicaid to have a 75% federal financial participation, which is an FFP, for the operation of the system rather than the administrative expense FFP rate of only 50%, which could be faced for unapproved systems. As our healthcare civil servants have explained, Guam taxpayers could pay twice as much if the system Guam Medicaid acquires on it, acquires it on its own, is not able to meet CMS standards. So what does this mean for patients, Madam Chair and colleagues? Is benefits include faster processing of claims, an application, and more convenient online portal that will cut down processing time. This challenge also means that government personnel can be reallocated from manual processing tasks to customer service and case management rather than hire more employees. It will reduce the errors, delays, and other administrative burdens that come with paper-based applications and automate workflows to make the multi-step process easier to track and manage to completion. All of these improvements will bring down the risk of penalties related to non-compliant compliance of established timeframes, while also offering robust audit capabilities. In closing, Madam Chair, I want to extend my thanks to my co-sponsors, Senator Royce Canata, Senator Duenas, Senator Will Parkinson, Senator Lahan, Senator Blas, Senator San Augustine, Secretary Amanda Shelton, and Senator Dwayne St. Nicholas for co-sponsoring this legislation. And I personally want to extend my undankulu na sidus maasi to you, Madam Chair, for quickly scheduling the hearing for this bill, and I pledge to work with your office to finalize any changes in time for this bill to be included at this end of the month session agenda. It is certainly encouraging to see the positive consensus being shown for this sorely needed improvement to our publicly funded health insurance program. So, Madam Chair, when tens of thousands of families need this coverage, when private clinics plus our government hospitals need this revenue, we must do everything in our power to make Medicaid as efficient as possible. Now that our federal partners are recommending this strategy and our local experts have concurred this bill is in need in order for Guam to take advantage of these partnerships, it makes sense for the legislature to respond accordingly. So, Dankulu na sidus masi again, and also, Madam Chair, for your help in making sure that Mr. Smith from the Virgin Islands, who's the Executive Director, is online for this public hearing and to share some comments.
Sidus Masi, Vice Speaker, for your opening statement. So we're going to, if that's okay, we're going to recognize Director Gary Smith. He's on East Coast time, so I appreciate your cooperation. So at this time, I'd like to recognize Director Gary Smith on Zoom.
First, can you all hear me?
Yes.
Okay. Good evening. It's now 9:41 here in the Virgin Islands. But Madam Chair, Vice Speaker, and members of the committee, citizens of Guam, thank you for the opportunity to provide testimony on Bill number 274-37, authorizing Guam Division of Public Welfare to join or use contracts of other states, other government procurement units, or not-for-profit entities comprising one or more states or government procurement units. And first, on behalf of our Governor Albert Bryan Jr. and the more than 100,000 American citizens living in the U.S. Virgin Islands, we bring you greetings. And as we say in the Virgin Islands, a pleasant good morning or evening. I appear before you today to share our experience of the leverage and reuse partnership with West Virginia, which was established back in 2009 by our Governor John DeYoung Jr. From the Virgin Islands and Governor Joe Manchin of West Virginia. The success of this partnership has been proven over time, and it continues today through peer-to-peer collaborations around care coordination, policy development, provider management operations, and claims processing. Both USVI and West Virginia Medicaid Management Information Systems, or MMIS as we refer to, operations are supported by the same vendor. And because of this, there are similarities in service, process, technology, provider enrollment, claims processing systems, and operations. And the benefits that it has, the leverage and reuse relationship has brought to the Virgin Islands includes, but are not limited to, the sharing of systems, modules, code, contracts, developed artifacts. So we here in the Virgin Islands have benefited from all that I just listed in, joining ourselves with the West Virginia Medicaid program. Risk reduction during development, implementation, maintenance and operation, and business processes and systems. Significant savings during the implementation and operations process. And during the implementation process, CMS awarded us 90% FFP, where the Virgin Islands only had to come up with the 10%. And we're now in a maintenance and operations phase, which we're now only paying 25%. The leverage and reuse also provided us the opportunity for significant savings during the implementation and now the operations process. And so we paid 9% of what West Virginia paid to implement their MMIS system. They paid $298 million. We paid $28 million. It accelerated the development and implementation timelines. We were able to implement our MMIS system, which is also certified. We were able to implement our MMIS system in 10 months. And it took them, I think, about 2.5 to 3 years. It has improved the overall security and the interoperability of our Medicaid enterprise system, Medicaid program management guidance, and technical advisory support and multi-state forums. So there are a couple of multi-state forums that we are able to join because of this leverage and reuse partnership, as there are other states benefiting from this endeavor. So in closing, I appreciate the opportunity to share my views with you and look forward in continuing our work with Guam's Medicaid program to achieve success, improve health outcomes for Guamanian citizens, and I'm honored to be here and open to answer any questions you may have. That's my short testimony for this evening.
Thank you so much, and good evening to you, Director. At this time, we'd like to open up questions for you, and then we'll proceed with further testimony from the local panel here. So I'd like to recognize Vice Speaker.
Thank you again, Madam Chair, for this opportunity to address Mr. Gary Smith. Mr. Smith, I know that there are some concerns about us joining an existing contract of another state or territory instead of beginning competitive procurements locally. Can you provide some context on how other states and territories procure these systems? Are they all procured through competitive bids, and are they subject to any federal rules and regulations that protect taxpayers' funds? So I know that you did touch on it briefly, but if again, can you provide some context of how other states and territories procure these systems, and are they all procured through competitive bids, and are they subject to any federal rules and regulations that protect taxpayers' funds?
Sure, thank you for that question. I can share with you our example. So this arrangement with West Virginia went through the procurement process to acquire the services of then Molina healthcare systems to design, develop, and implement their Medicaid management information system. So, because CMS supports the leverage and reuse, CMS encourages the reuse and sharing wherever practicable to So because of the blessing of CMS, and it is something supported by CMS, our procurement office unit allowed us to procure a sole source contract with Molina Healthcare System and align the terms and with the West Virginia contract. So our contract with Molina, which is now Gainwell Technologies, they have gone through a couple of acquisitions, is aligned with the West Virginia contract, which made sense because we took the technology that was already designed and developed and implemented it here and tweaked it or designed it. You know, there were certain portals that we did not require. For example, they have managed care. We are a we're 100% fee for service program. So we do not have the managed care portal of their system. Thereby, because it was already designed and developed, you know, we did not have to pay for that additional expense or those additional hours where the engineers and also the system developers would have had to spend in designing a separate system for us. So our process was we formulated the contract, submitted the contract to CMS for their approval. CMS approved that contract, thereby submitting that approval document with the contract to our property and procurement unit. Thereby, the process to acquire those services was approved, and to protect the taxpayer dollars from scrutiny. I hope that was response was helpful.
Thank you so very much, Mr. Smith and Madam Chair. I truly appreciate the comments based on the inquiry presented, because as we look at CMS desiring that we joined in this or emulate this mechanism and this process moving forward for DPHSS, I think it's really, really important that we follow lead. And as we see the successes, we already know that the percentages for application, for claiming and for receiving will be so much faster. And what better way when CMS is saying you guys should do it. But thank you very much for this opportunity. And again, thank you for hearing this quickly. And Mr. Smith, thank you for your time. Sainamasi, and God bless.
All right, thank you, Vice Speaker. So we're going to have, I'm going to ask questions, and then we're going to also invite other senators to ask questions as well. Oh, okay. All right, so we're going to suspend questions at this moment because we have Director Edward Dolly on Zoom to provide testimony. Director Dolly, you are recognized.
Yes, ma'am, and I thank everyone for their patience as we work through the technology challenge that I assure you was most likely completely on my end. And I appreciate everyone's patience and attention to the idea and concept of joining the multi-state collaboratives, or considering the idea to let your Medicaid program participate in joining contracts that are already in place. And I want to pick up on the thread of the lady who was speaking as I joined. It most certainly will allow CMS to be quicker and more prompt in the review of your procurements and contracts, and that they have already been previously approved, and work through the terms and conditions. It allows us to focus specifically on the items that are of particular interest. And in the technology world, that's really increases the speed of the delivery of the service to the Medicaid program. Looking at the national program, we see great success in Medicaid agencies who have leveraged these opportunities, and not only to saving time on the procurement aspect itself, but also leveraging the lessons learned from other agencies. I see.
Okay, sorry, excuse me, Director. Can you clarify your organization? Are you government or are you a for-profit or not for-profit? What is your entity that you're representing?
I apologize and I'm sorry. My name is Edward L. Dolly. I'm the Director of the Division of State Systems for the Centers for Medicaid and Medicare Services. I'm not for profit. I'm with the federal government. My team is responsible for reviewing the advanced planning documents for IT systems funding. I'm the signature authority for the advanced planning documents and the enhanced match that the federal government provides for those projects. The ongoing funding that is available for the territories, as well as the appropriation that was carved out as part of the CAA. So my shop has responsibility for that advanced planning document process and the oversight of the money and the IT system projects that serve the Medicaid program.
Thank you for that
So
clarification.
not for profit.
Yeah, so can
Sorry.
you, what does CAA stand for? And thank you for that clarification. And you can proceed with your testimony as well. Thank you.
It's the Consolidated Appropriations Act.
Thank you.
There was a specific carve out for the federal for the Pacific territories as well as the Virgin Islands, and I see the esteemed Gary Smith on here. Thank you, Gary. That allotted $20 million in total for those territories to address improving or increasing the efficiency of their IT systems in the Medicaid program. So I oversee the staff that monitor and approve the funding for that carve out.
Okay, thank you. And please proceed if you have further testimony.
No, I just think I apologize again for the technology issues, but I was so excited to have an opportunities because it really is a time saver for the Medicaid program to be able to leverage other contracts. And again, it makes the process, in our oversight responsibility at CMS, we are required by regulation to review procurements and contracts related to these IT initiatives. And when a state or territory takes advantage of a contract that's been previously executed, it just makes it so much faster. Because having already been through the process, it allows us again to just focus on things that are specifically called out or different as it relates to the services that are being provided to the territory, therefore making the speed of that review that much faster. And then the other piece that's so important is by leveraging those contracts, you're taking advantage of lessons learned from other entities that have already executed the contract and already engaged with the vendor and began their initiative, thereby allowing your staff to maybe avoid trouble spots that come with the initiation of the project or that are encountered as they go on. Medicaid IT projects are inherently complex. They are detailed and difficult to implement, but but ultimately everything in service to the beneficiary. So if your staff has the ability to work with a team, and see Gary understands someone who is already working toward that end, that lessons learned and that leverage and reuse opportunity is, you can't give time back, right? Money's hard enough to come by, but nobody can give anybody more time. So the ability to leverage somebody else's lessons learned is just invaluable. So I applaud the territory for considering the opportunity, and I want to, in my strongest, most possible terms I can, encourage the thoughtful consideration of and meaningful adoption of the ability to do and exercise those types of contracts and contract vehicles. And happy to take any questions if there are any.
Thank you so much, Mr. Dolly. So I'd like to open the floor to Vice Speaker if she has any questions of the Director.
I don't have any questions for Mr. Dolly. I just want to thank him for literally also taking the time to come out for this public hearing and seeing the need and the importance of why this should be facilitated through our August body, because it will make it better for our over 45,000 applicants who are part of the program. So thank you, Madam Chair, and thank you, Mr. Dolly, for being here at such, I know it's late over there, so thank you again. Thank you, Madam Chair.
Thank you, Vice Speaker. So I do have a couple questions, and so this is definitely a step into cooperative purchasing, and I see the benefits, but so I just wanted to maybe figure out if you can help me clarify what is for us to go through this process for the vendor. So I heard there's, to what extent can we require competitive, bidding of this? because I understand with the U.S. Virgin Islands, it was initially competitively bid, but then it was turned into a sole source. Is that correct? Maybe this question is for Director Gary.
Yes, and so relative to the cooperative purchasing, the awards through cooperative purchasing already have gone through the competitive bidding process, meeting GSA standards, GSA federal standards, thereby, for example, NCPA. We are currently working through the NCPA cooperative agreement vehicle to acquire the services of project management office. And, as I outlined the process in having our contract with Van Molina, now Gainwell, wrote a letter requesting that we are allowed to sole source acquire these services through a sole source justification with CMS. Number one, we were familiar with the vendor, but then also the process that they had already gone through the NCPA cooperative agreement, the scoring, responding to the request for proposal and responding to the necessary questions and meeting all of the necessary requirements of the RFP. So by that, we worked with CMS, with Mr. Dali and his team, one of his team members. We just recently received that approval letter on Monday, and again have submitted that contract along with that approval letter to our property and procurement department, which we should be executing that contract hopefully in the next 30 to 45 days.
Thank you for that response. And then, so the other question I had is your cooperative agreement with West Virginia, where they pay, I heard, $280 million, and then you pay a fraction of that. So how was that negotiated? How was that negotiation process?
So I was not on board at the time. However, and then I will allow Mr. Dali to add to it because he's familiar with that process. But the system was basically already developed. So in developing technology, a vendor or a company, they will provide you with a scope of work. First and foremost, they need to find out from you what your requirements are. What are your end users going to need to be able to be successful in providing services? They're going to come up with an estimated number of hours to design, and develop that technology system. They have to build that. So the benefit to the Virgin Islands is the system was already built. So the vendor did not have to go through that same process for us. We took what they already designed, tweaked it to what our end users required here in the Virgin Islands, which they already built for West Virginia, and implemented it here. Thereby, that's why the significant savings to the Virgin Islands Medicaid program. And I will stop there and allow Mr. Dali to provide a different perspective. But from a customer perspective, that's where we saw that's my perspective as to why such the significant savings.
I appreciate your response. And so, yes, I'd like to turn to Director Dali if he has any other insight on this process regarding converting a vendor to sole source, or if there's a need for that when we engage in this type of procurement, as well as what do the negotiations look like between the main procurer versus, let's say, a territory that is joining in on that cooperative agreement?
Sure, and I thank you for the question. It's a great question. And for historical purposes, I actually was the director of the West Virginia, I was chief information officer for the West Virginia Medicaid program when that agreement was originally competitively bid and for the MMIS and the other services. And it had language from the very beginning that made all vendors aware that it was going to be a cooperative agreement, and therefore, they were to price accordingly, which is one of the benefits of a cooperative agreement, right? It has the opportunity, it gives vendors the opportunity for efficiencies of scale. And then to Gary's point, the way it works is all Medicaid programs are unique in some ways, absolutely. But at their core, there are some things that are consistent between them. So in the case with the Virgin Islands, the instance, right, or the application itself for the claims processing, we simply gave an empty set of that. All the rules were configured for the way that West Virginia did things. And then Gary's team was able to look at that list and go, these 5 things are consistent. These are the four or five things that we do differently here in the Virgin Islands, and only work on those 5 things. So they didn't have to do the entire list of things that an entity may need to do when engaging for a vendor, first up. So that saved the time and the money and the cost avoidance on the Virgin Islands side. And then going forward, they developed this concept of a change control board, whereas whenever there were changes that needed to be made to the system, whether because in response to regulatory changes or regulatory requirements, or just individual state or territory requirements, as Gary said, there was this notion of a pool of hours built into the contract. So the territory or the state have the ability to say, this is the change I need to make. The change control board looks at it between the 2 entities and has the ability to go, well, hey, I'm doing the same thing over here. Therefore, the cost should be less because you're only going to have to do it once for the 2 of us. Or if it's an individual cost, then it's still the economy of scale because it was bid for multi-tenant. You saved money because of that pool of hours is spread out over the everybody who's using the system. And then where you look at it and go, okay, this is only for the territory itself. The cost will be this, but it can be implemented in such a way that it doesn't in any way change what's going on over in the other tenant side, over in the other program side. So it's standalone and unique. Gary can do anything that Gary needs to do on a territory side in configuration of rules for his system. And it doesn't interfere with any of the other tenants who are engaged, right? But he has there is that, no, correct me if I'm wrong, Gary, there are meetings that go on every month where the change control process is discussed between the partners, and they look for that type of commonality to see, well, what's consistent, or sometimes it's not, this wasn't something that needed to be done. West Virginia would learn that from the Virgin Islands, we're working on something in an area of the program and go, hey, that's something we haven't done here, but maybe we should. Right. So then the program in West Virginia will save time because they've learned about this initiative that's already being done in the other program. And oh, by the way, the cost will be less because it's already being implemented over in the Virgin Islands. So that's the cost. That's an example of the cost savings and how the original contract was competitively bid. And it was at that time understood to be a contract that was going to be 12 years. Right. So they're still within the base period of that contract. There are times, and federal regulation allows for contracts to then be added on to in a sole source type of an arrangement where it's the incumbent vendor, there's already the relationship going on, and the speed of the service of the delivery to the program would be interrupted if you were go through the competitive process to have someone come in and pick up the middle of something that's still being implemented. So that ability for sole source is understood and called out and allowed for in federal regulation, right? So it's not uncommon, right? But originally this contract was competitively bid, had multiple vendors submit responses to it, and ultimately for total fit, it was awarded to, it was then Molina, it's now Gainwell.
Okay, thank you for that response. So
Yes, ma'am.
I know in our procurement law, whenever there is an add-on, let's say the scope of work changes, we have to rebid it or resolicit. So with the cooperative contracts, is that already embedded in the contract where it can add on new jurisdictions, or would that cause I guess a change of scope, kind of resolicit the whole project again? I don't know if you understand that question, because
So,
I think I do, and I can say it back to you if that's helpful, or at least make sure that I'm clear in what I'm responding to. In this instance, if we're talking about the contract that Gary is using with West Virginia, in the very beginning, it had language written into it that it could be used by any other state, territory, political subdivision, or there was a bunch of sentences we put in there because the idea was we wanted it to be available for other Medicaid agencies. And the scope of the contract was written such that the system would perform activities for the Medicaid program. So other people joining the contract would not require a resolicitation for that contract. And that's how most of the cooperative agreements are structured. And I believe there was some notion of looking at potentially the NASPA, the National Association of State Procurement Officers vehicle as well. It's originally designed as a multi-vendor and a multi-vendor setup. So other people joining does not trigger a reprocurement as long as the services that they're asking for were contemplated under the original scope of the contract. There are no issues. And then when it comes to CMS to do an approval, as I said previously, our agency is required by regulation to review contracts, RFPs and contracts for these IT systems. We look at it and go, does your state or territory purchasing manual allow you to use cooperative agreements? If yes, then we can move on down the line. And then we go, the services that you're asking for, does it fit under the existing scope? We look at that. That's part of our approval process. But again, that's the only thing we look at. Whereas the first time we get a contract, we review it start to finish because we're required to. But in a cooperative, we don't have to do that because we've already looked at that master contract and said, yes, those services as described in the scope are approvable. All the activities are matched. All those things work and are good, and we give our approval. So when it comes through, say another territory would like to join, we look at it and go, does your procurement manual allow you to do that? Does your local law allow you to leverage cooperative agreements? That's why this hearing is so important, right? Because if not allowed to do that, then by rule, CMS is like, then we can't approve you using this contract. So we look to see if it's allowed. If so, then we skip all the other services stuff and we look specifically at what is it your territory wants to do. Oh yeah, does that compare to the scope? If so, it's a yes, and you save all that time that typically is taken up for a review of a contract. Was that helpful?
Yes,
Madam?
that's very helpful. The other question that I had is the partition of costs. So I guess the host government would pay more and the territories would pay less. So what are the negotiations that go into that, determining the cost of that to the territories?
I can speak to how the original go ahead, Gary. You can, Gary, or I can talk to the original. It's up to you.
yeah, so I know I just wanted to share what we spoke to earlier. The level of effort necessary to implement the MMIS in the Virgin Islands was 91% less based on the pricing. They paid $298 million for their design, development, and implementation. And to Ed's point, we had the list and said, we only need these 5 out of a list of 25. So that's a lot less time or a lot less man hours to come up with that significant cost savings. And then on top of that, it's already designed. They don't have to take it from scratch or take it out of the box. as they say in technology terms, and build it from the ground up. It's something that's already built. I don't know, let me see if I could draw a good example where if you're looking for some office space and you're going to move into a space that's already built out versus one that you're getting a shell. If you get a shell, you're going to pay more money to build it out than move it into someplace that's already, built out and furnished, and you can move right in instead of having to pay the cost to build it out.
Okay, I appreciate that analogy. But again, I guess the question is, so one thing about sole source, right, it's non-competitive, and generally they come at a premium cost. And because it's sole source, there's no competition. Have you seen rising cost since the conversion to sole source? And I guess, I understand the importance and in cooperative purchasing, right? You reach the economies of scale, but just, as, us beginning this process, these are just some questions that I have to kind of, I guess, some issues or concerns regarding sole source. I guess this question is for Gary, Director Gary Smith. Have you seen cost increase since the conversion to sole source?
No, what I've seen cost increase is attributed to inflation and the cost of vendors being able to hire the skilled professionals to provide the services. When it comes to determining price, we use several entities. We work with CMS. We also work with our sister agency, specifically West Virginia. I will always pass something through Mr. Brandon Lewis, who's now the director of Medicaid Enterprise Systems for the Medicaid program, very well versed. But then also there are several, as I mentioned in my testimony, there are several groups that, because of the leverage and reuse relationship, we have the opportunity to have those discussions about pricing with other states that are, you send out a request, hey, I'm getting ready to do this. What were the costs that you experienced? But the benefit that we have with the leverage and reuse is more than likely it's already been designed and developed with West Virginia. So my cost is definitely not going to be comparable to someone who's gonna have to do that from the beginning. I hope that that's helpful, but the sole justification, I think, provides you the opportunity, like Mr. Dolly mentioned, learn from lessons and processes that someone already went through to eliminate those pain points and those mistakes that they made, so you don't make those same mistakes again, thereby helping you to mitigate your cost.
Okay, thank you. One thing the bill does, it mentions government, not-for-profit entities. And so maybe this question is for Director Dolly. I guess in your implementation of this program, I guess, what is the landscape as far as these cooperative agreements? Is it predominantly government or not-for-profits? What would your recommendation be?
Well, I want to make sure I say this correctly, because I'm with the federal agency. I'm with CMS, so we only work with the Medicaid agencies within the states and the territories. But the language allows them to leverage agreements that may be with non-government entities. And that's just to give them the broadest advantage possible for these contracts that may be out there, right? Because from the CMS perspective, we don't know all the services that a Medicaid agency may need. right? But we do know they need the ability to do them. So it is not uncommon for the Medicaid agency to exercise contracts that are in place in some states, they exercise contracts that have been executed at a county level for a local government. They have a contract that had already been in place and had the service and or software available to them. And instead of going through a procurement at the state level, they just jumped onto something that had already been done at a county or at a territory. So that is not uncommon at all. What we just ask that the language in the contract be as expansive as possible to allow the Medicaid agency to leverage an existing cooperative agreement regardless of who put it out. Right? That we just, because to CMS, we don't care. As long as the contract is permissible under your local rules, it doesn't matter to us who executed it at what level. But we and my team and my place, we only review contracts from the Medicaid agency. But that Medicaid agency can use contracts with any other entity, state, local, not-for-profit association, and we see all of that nationally. It is not uncommon for a Medicaid agency to exercise contracts through, say, their that maybe have been issued by their hospital association, potentially by their educational system, or maybe by the higher education and local education. We see that in across the country, right? It's just that the Medicaid agency puts out a call and says, I need this service or I need this type of software. And if they see that it's already been procured, it doesn't matter to CMS, who owned that contract originally. We look at the terms of it and go, does it fit? The same thing kind of touched on earlier. Does the scope seem to match what the Medicaid agency is saying they need? And if they're therefore yes, then all things are green. So I think that's why the language is originally in there, because it doesn't matter who originally put the contract out, as long as that contract allows for other entities to join it. It's just given the permission for them to do so.
And if I may add, Madam Chair.
Yes,
so
please proceed.
So I mentioned to you, we're currently working on acquiring the services of a project management office through the NCPA cooperative agreement. And that initial contract was the initial request for proposals was sent out by the Department of Education of Texas, one of their counties. However, the services that are included in that contract fit exactly what we're looking for. Thereby, that's why we chose that cooperative agreement vehicle and that specific contract. And with CMS blessing that, our procurement unit is supported at 100% on board and supported it as well. And also regarding the cost, their fees are already established. So what the fees are going in. So there's no opportunity for them to change their fees. Their fees are already established. The fees are what the fees are. So I just wanted to add that and hope that was helpful to the question that you just posted.
Yes, thank you very much for your responses. I'm going to open up to the panel for questions to these two gentlemen. Senator Brown, you're recognized.
I don't have any questions of them, Madam Chair. I think they reiterated their point time and time again. I'm just curious how this would play in with our procurement here. It seems we're simply allowing us to, I guess, get on the train with regards to an existing contract so that we could help facilitate Medicare processing. So that's essentially what I understand that this bill is going to do. So I don't have any questions, but I certainly appreciate the time and the effort that they provided to facilitate this information to us. So thank you to them as well. Thank you, Madam Chairman.
Right, thank you, Senator. Senator Tadiqui, if you have any questions with the two gentlemen.
Just one from the fiscal note that was provided on this bill, Madam Chair. Carlos, I think this question will go to you, because it says, absent pertinent information from public health relative to the estimated cost and or potential cost savings to join or use the contracts of the state's procurement unit and not-for-profit entities, the Bureau is unable to determine the fiscal impact of the government gone should this bill be passed into law. So can you speak on that since they didn't have a chance to get your information?
Yeah, I understand what they're saying, BBMR. I don't know what the impact would be because I don't know I'm not an IT person. I do know what we're spending currently on IT services. I can talk about that. I don't know what the impact would be in terms of, there's a lot of different projects that the federal law is going to require us to proceed in the future, at least within the next 5 years. I have no idea how much those projects are going to cost at this point.
Okay, so there's really no, do you see any savings by utilizing this? Because if you don't know the cost, then you don't know the savings, right?
Well, what I can say is savings could be realized operationally in terms of time and effort that we're expending. Not having a fully compliant system. Just to give you an idea, and Mr. Byrne emails me all the time about, when are we going to get the audit done and stuff like that, and I have to go through our system and pull in data and information to respond so that it reflects what we're reporting to the feds. Savings will be realized if they approve a system that is compliant. We're going to be paying probably half of what we would normally have paid for its operation using the local dollar.
Okay.
And also, if it's a compliant system that CMS endorses, usually through these other states, they'll pay 90% of it. Whereas we may have to find the money to do that.
And then you also recommend in your testimony to incorporate the other programs as well in your testimony. Can you elaborate on that?
Well, that's actually the director's. I'm just here to present the director's testimony. But I do support the department having access to it because there's a lot of other IT things that could be done that may not necessarily be for
just MIP.
Medicaid
program.
But also you have CHC, the health centers, electronic health record systems, maybe perhaps leverage and reuse, or just general authorization to do these things. Maybe we can have some kind of insurance exchange system. Things that states have been doing 9 years ago. We can catch up with what they're also doing, and these are, I can't give you costs because I'm not an IT person, but my intent is, because we're getting about $6 million from CMS as a part of the CAA, Consolidated Act, and a lot of this is primarily for program integrity, compliance with reporting and so forth, to be invested into our IT systems. But we have to think long-term as well.
Right. Yeah, then, okay, well, I'm pretty sure that you guys would also look into ensuring, any kind of cyber, what's the maintenance of these IT programs and systems that are brought in, and what possibilities that are there to ensure, the data is not, lost or hijacked or in any way. So, okay, well, thank you so much, and take your consideration, or this testimony in consideration. Thank you, Madam Chair.
All right, thank you, Senator Tadigui. So at this time, if there are no further questions for Director Gary Smith, Director Edward Dolly, are there any more questions for these two gentlemen so we can excuse them? All right, thank you so much, Director Dolly and Director Smith, for your time and your willingness to testify at such a late hour. I'm sure we'll reach out for further questions if need be. So thank you very much.
Thank you
you
again,
for
Madam
having-
Chair, for allowing an opportunity.
Yes.
All right, and good evening.
Bye-bye. Okay.
All right, so at this time, I'd like to recognize Carlos Pangilinan from the Department of Public Health, who will be providing testimony. You are recognized.
I'm just going to be reading the director's testimony. Dear Madam Chairwoman, Buenas and Half a Day, Chairwoman Sabina Perez, and members of La Legislatura and Guahan. My name is Peter D. Camacho, Acting Director of the Department of Public Health and Social Services. I'm here to provide testimony in support of Bill number 267-37 with some recommendations. In September 2023, DPHSS completed a Medicaid-specific strategic plan mandated by the Consolidated Appropriations Act of 2023. Under this strategic plan, the department indicated its intention to improve, update, and enhance its mechanized claims processing and information retrieval systems and eligibility and enrollment systems. These systems are key to administering Medicaid because they maintain data on enrollees, including healthcare services covered, expenditures, and claims data. As a matter of policy, the Centers for Medicare and Medicaid Services, CMS, encourages states and territories to leverage and reuse systems such as the Medicaid Management Information System, MMIS, or the Enrollment and Eligibility System that have already been developed or implemented using federal funding and meet CMS standards. Since 2016, regulations and guidance has been in place on promoting, sharing, and reusing such technologies amongst all states and territories. The intent of these policies is to reduce duplicative efforts and spending on the development of these systems. Thus, approved and qualified systems are subject to enhanced federal financial participation of 90% for their design, development, installation, or enhancement, and 75% for their operation. This contrasts to the 50% financial participation, which is allowed for non-compliant systems. Under current law, it is not clear if the DPHSS, Division of Public Welfare, which administers Guam Medicaid program, is able to leverage and reuse systems. However, in contrast, our sister island territory, the U.S. Virgin Islands, which is the closest comparable to Guam in terms of population size and economic characteristics, has an operational Medicaid Management Information System, MMIS, for claims processing. This was implemented in partnership with the state of West Virginia in the year 2013. West Virginia uses a system that already processes nearly $5.2 billion in Medicaid benefits annually. USVA, rather than paying for a new system, pays West Virginia the cost of maintenance and operation of the MMIS. With economies of scale, USVI, which processes about a mere $140 million in Medicaid benefits and works with a system that has the resources and ability to ensure federal data reporting and operational requirements of a $5.2 billion Medicaid program run in West Virginia. Federal provisions allowing the sharing, leveraging, and reuse of data systems of other states and territories will greatly improve the efficiency and effectiveness of the Guam Medicaid program for its beneficiaries, caregivers, and for hundreds of enrolled providers that deliver services to Medicaid beneficiaries. In closing, DPHSS supports Bill 267-37, but is respectfully requesting amending the bill to include the department and its various programs to be part of this proposed legislation. Already, Public Law 31-212 allows the Guam Women, Infant, and Children's WIC program, which is under DPHS Division of Public Health, to join or use the contracts of other states or governments units in the United States. Should Bill 267-37 pass, and with the requested amendment, there may be further benefit for the community, as DPHSS as a whole may now be able to tap on other contracts within the U.S. to gain access to technology and other procurement needs in a more expeditious manner. Thank you for your time and kind consideration. Signed, Peter John D. Camacho, Acting Director.
It's Masi, Carlos, for your testimony. So I'd like to recognize Director Byrne for his testimony. Thank you for being here.
Thank you, Senator. and other senators here this afternoon. Department of Administration clearly supports any proposal which leverages federal funding and improves the processes and the spread of welfare benefits to as many people as are entitled to that benefit. We want as many people as possible to subscribe to Medicaid so that any health liabilities which might otherwise arise as a result of health issues, both emergent and potential, can be dealt with this system, which provides a large measure of federal funding to all our providers, and of course, in particular, to Guam Memorial Hospital. With respect to the procurement issues that have arisen during this hearing and are inherent in the bill, we have used cooperative agreements, especially with NASPO, not as sole source, but we've used that particular pricing under that agreement as one of the bidding providers. It's not been possible to use as many of these cooperative agreements with NASPO as possible because for most supplies, the pre-negotiated agreement includes transit freight. And unfortunately, because we're such a long way and freight is such a large element of the pricing, the pricing that was provided by the cooperative agreement really didn't compensate the vendor for freight. So although all these cooperative agreements permit local changes, they don't permit local pricing changes, and that prevented us from using the cooperative agreement for supplies. But we have used it for services. There was an IT cooperative agreement signed, and it was used as one of the bidding. In fact, it became the winning bid for some IT services that we're currently using today. We don't have any current experience of cooperative agreements with other jurisdictions, but I certainly welcome the ability to do so. Unfortunately, Public Health did not send us a copy of the letter either to the Procurement Policy Office or to GSA, but I read it because it was attached to the information for this hearing. And generally, we would certainly support any effort to reduce costs, to leverage upon other people's experience, because that certainly is an element, is that if somebody has gone through, and it sounds like West Virginia has gone through this process before and ironed out all the problems, we would certainly welcome that. An example that I can certainly mention was when we had to institute at very quick pace the COVID unemployment payments. That was done very quickly. That was done all with federal dollars, so we didn't have to put up any money ourselves. But that integrated pretty well into our existing financial system, and we were able to get out, those 20,000 checks that we were able to every other week. So that would be a very good example of using the experience that the vendor had in other jurisdictions to our benefit. As far as the electronic part of this is concerned, I think I've spoken before about the need to integrate some of these systems into the financial system. I trust that any process to do so here would also allow that to happen. Every budget that is passed by the legislature requires planned procurement. very few agencies actually comply with that. We certainly hope for fiscal 25 that we're going to get a better response. But in this particular case, we will take note of the need and make sure that, that whatever we need to do at our end, both administratively and in respect of procurement issues, we will make sure that we try and deal with them as efficiently and as quickly as possible. Thank you, Madam Chairman.
All right, thank you, Director Byrne. So we're going to open up for questions. Vice Speaker, if you have any questions.
Thank you again very much, Madam Chair. I think I'll address this next question to Carlos and hope he can answer this. What benefits do you see will be afforded to clients and healthcare providers when these new systems are online? And then I know that there were discussions with my office about how the current law has some ambiguous language that you recommend be clarified through this bill. Can you explain to this committee what this ambiguity is and what interpretations or risks you see trying to join an existing contract if this law is not clarified and expanded to your division?
I'll address that part first. So to me, the ambiguity would really be simply what entity is allowed under the law to do this, and that's BES and WIC program. With this particular, what Gary and Mr. Dolly were talking about has a lot more to do with Medicaid issues, Medicaid systems. If we wanted to improve the eligibility system, which would be great, that would certainly be a benefit to the clients and applicants. The current statute says BES. BES handles eligibility for Medicaid and SNAP. However, BES doesn't handle the claim side, the processing of claims. So we have resources to do the eligibility side, but everything else, claims processing, accounting, and so forth, and especially data reporting, which all the territories have fallen behind over the years, except for USVI, that would be greatly enhanced. So that's all HCFA, Bureau of Healthcare Finance Administration, and they're not under the law. So the Division of Public Welfare is the division that has both bureaus, except for WIC.
Thank you very much for that. Ed, would you like to add anything to that, or?
No, I didn't understand the distinction before, but now I do. Thank you.
No worries. But I truly appreciate the answer provided. And again, as we look at this measure going forward and seeing the successes as it is in other jurisdictions, what better way when we have that opportunity, not just to fix Medicaid. We've seen the successes on the programs it has today, and moving forward where this is something that CMS wants. So I truly appreciate that. And thank you, Madam Chair, again, for giving me the opportunity to talk and speak in support of the efforts of this bill. Senator Masi.
Ms. Masi, Vice Speaker. So just questions for Director Byrne. So you said you've used cooperative purchasing before, and under what authority was that?
With NASPO, a NASPO cooperative agreement.
Okay, and is that currently authorized in law? How is that currently authorized?
As I explained, it was used as effectively one of the bids that was solicited.
So, so should this become law, what type of, so you're also the head of the policy office. I would imagine that there'll be regulations that would need to accompany this. Do you have any timelines as far as accomplishing that?
We're in the process of recruiting, and I hope it will happen in the next 30 days, a procurement council. It will be the job of the Procurement Council to bring all our regulations, which now need to be updated to comply with current statute, and it will also be the duty of this Procurement Council to update procurement policy regulations and address any procurement policy issues that arise from emergent legislation. If, in order to make sure that this is addressed, we will certainly give it priority, for we all see the benefit in improving access to Medicaid and the Medicaid process, especially if it's going to result in a greater capture of federal dollars.
And so what is the timeline you think, 6 months?
I would hope 3.
3 months, okay.
Yes.
All right, so this question is for Mr. Pangilinan. So currently, what is the cost of this program, to carry out this program?
If you're talking about all of the requirements to run a compliant system for Medicaid purposes, I have no idea. I can tell you what we do pay now on IT systems, but I would preface that by saying, you know, what we spend on IT, you know, and especially to Senator Tello's question about cost, you have to think of cost in terms of what is not being met. So we may be paying, let's say, $1 million, right, on IT services. Some of this is for eligibility, some of this is for Medicaid. Half of that, because it's a 50-50, most of, you know, about 95% of that money is federally matched 50%. So that's about $500,000. But what do we currently have going on in terms of program delivery? Guam, for the last 12 years, has been in the bottom 5 in terms of timeliness of processing of applications for welfare. Also, error rates. We have challenges in terms of just processing claims. Every time there is a change in federal rule, some type of new coverage, some type of eligibility standard that changes, I have to figure out ways to MacGyver whatever we're working with. Okay, this is the new system. I mean, this is the current system. What can we do currently to just meet the requirement? But yeah, to me, what would be great is, I mean, if just on the IT alone, if we're spending $500,000 right now, our local dollar, for $1 million program, I mean, IT services, you can look at it this way. We could expand that $1 million program to a $2 million $2 million in IT services with the federal dollar, as opposed to just 50%, $500,000 from the Fed. So think of the possibilities. Or we could also just cut our cost, even though I wouldn't say what we're paying right now is sufficient to do the things that we would love to do.
Okay, yeah, I think, you know, this is important because, you know, we know there's a lot of our community that doesn't have access to healthcare. And so any way that we can streamline that process, I think that's really critical. So I see the value in streamlining it. I would like to have more information, if you can provide more information about the costs so we know what we're, you know, what we're signing up for. Also, what jurisdiction, so I know U.S. Virgin Islands is affiliated with West Virginia. Have you given it some thought as to which jurisdiction we will be affiliated with?
Not for Guam. We haven't really decided if we're able to do this. We haven't really, I mean, we've looked at other states, and I know we've looked at Hawaii. We looked at West Virginia. What I do know is I think CNMI, which doesn't have a system at all, is probably going to be teaming up with Alabama. West American Samoa doesn't have a system either, and I don't think they're at that stage where they're, deciding what, they have kind of a different situation. Their program is completely different from ours. But in the last 2 years, we have this working group with the territories, and we talk about this all the time. And everyone's like, this is great, this leverage and reuse program that CMS has is going to help. But I can't really say, I'm not quite sure we could do that here in Guam because of our law. I only work from the program level. And what I do know in the past, when WIC tried to do this in 2012, AG's office just basically told them, you can't. That's why the law was changed.
Okay, and then as far as criteria, do you have any considerations about which cooperative agreement would you be affiliated with? Just kind of trying to...
No, not at this time, ma'am.
Okay. And if you can maybe provide that at a later time? Is there any research that you've done to help perhaps implement this?
Yeah, I can share, I'd be more than happy to share whatever. And if you want, you can just email me, what specific, I can give you costs for IT, and I can also share my thoughts on the dialogue that we've been having with our partners.
Okay, yeah, that would be very helpful to bring some sort of definitive concept of how this is going to be implemented. So I appreciate if you can provide that to the committee as well as to the sponsor. All right, so thank you for those responses. I'm going to open up to the floor to my colleagues. Senator Brown, if you have any further questions to the panel.
I did want to ask, because, I mean, the company may have this, this agreement if we go with the state here and with the Virgin Islands or whatever, but I'm assuming this company has this agreement in place to procure these services for a certain period of time. What are we doing? Are we doing it indefinitely with this company? I mean, this sort of, unless we do some special agreement, even if we do, this is certainly contrary to the normal procurement process that we would have to procure these type of services. We'd be using our government agreements to bridge over to allow us to participate. But is this going to be indefinite with this one company forever and ever? Is there going to be a period of reevaluation, or how are we going to proceed from that? Because like I said, this is totally contrary to procurement.
Well, if you recall what Gary said, I think they joined with West Virginia, and I believe that contract expired. It was, I think, over the course of maybe 9-10 years. Honestly, I don't know. I don't know what, but my understanding from when that contract expired, then they did the sole source.
Well, I just think it'd be good to have some more clarification with this. I mean, it's one thing government to government, but this is government to government with a private company that's doing the processing. And I certainly see all the benefits, of course, that it's being put forth, to cut down the time of processing, and we're not having to learn the whole wheel, creating the wheel all over again. But again, I just think those questions need to be answered. And then for what period of time? Are we going to be dependent upon, in this case, for example, the state of West Virginia, whenever they get around to expiring a contract, they will be the ones to go out and procure a new vendor or whatever the case may be, and then Guam continues to participate. I just think it'd be good to get those questions answered, because again, this is just, it's just contrary to what our procurement process would be normally. So I just think we need to note that and get some answers with regards to how that's going to proceed. Because we are paying for the service out of the federal funds that we're receiving to begin with. Thank you.
All right, thank you, Senator Brown. Senator Taitigui, if you have any further questions or comments.
No, and I apologize. I didn't realize we were only asking questions for those off island. I just jumped the gun, but I think those who are here today testify. Thank you so much for being here. I'm sorry, just covering your lunchtime, but don't overeat. Okay, bye-bye.
Okay, so we are going to wait on the Vice Speaker for any closing. No closing? Okay, at this time. All right, so Should we wait? Okay, okay. All right, so at this time, I believe there is no closing by the sponsor of the bill. So the committee will continue to receive written testimony until 4 p.m. Wednesday, May 8th, 2024. Please address all testimony to Senator Sabina Flores Perez, Chairperson of the Committee on Environment, Revenue and Taxation, Labor, Procurement, Statistics, Research, and Planning, which can be dropped off the mailboxes here at the Guam Congress Building or emailed to office@senatorperez.org. Being that there are no further testimony or questions or comments on Bill 267-37 COR, this bill has been duly heard. Thank you for your testimony and time today. We're going to move on to the next item of the agenda, which is to hear, we're going to go back because we skipped over Bill 273. So we're going to receive testimony on that. And we did receive some written testimony by the PUC, but thank you so much, Assistant General Manager Badassi. Thank you, Mr. Pangilinan and Director Byrne for your testimony. So we're going to receive testimony on Bill number 273-37, introduced by Senator Sabina Flores Perez, co-sponsored by Vice Speaker Therese Terlaje and Senator Chris Barnett. It's an act to add a new section 14104P to Article 1, Chapter 14, Division 1, Title 12 Guam Code, annotated relative to authorizing Guam WaterWorks Authority to establish a customer assistance program to promote water conservation and to facilitate repairs on private property. I'd like to, at this time, provide introductory remarks. Bill 273 authorizes GWA to establish a customer assistance program to assist low-income ratepayers through supplemental bill assistance through credits, discounts, and the reduction of or waiver of fees. Additionally, the program would help facilitate water leak repairs on private property while promoting water conservation. Customer assistance programs are implemented in other jurisdictions in the U.S. to ensure access to clean drinking water for its residents. U.S. EPA recognizes the need and sets metrics for affordability, which are then used in developing compliance schedules. The establishment of customer assistance programs may facilitate extension of the compliance in addition to providing financial relief. Bill 273 will assist in leak detection and expeditious repairs for those eligible for the customer assistance program. In particular, low and fixed income households may not have the resources to fix leaks and are vulnerable to escalating water bills, which this measure intends to address. Additionally, reducing water loss on private properties is an important measure to reducing the amount of non-revenue water of Guam WaterWorks Authority, thus reducing operational costs and ultimately supporting ratepayers of Guam. Bill 273 authorizes water conservation initiatives, including rebates for water conserving fixtures, audits, and information education. With the advent of El Nino and subsequent dry spell, it is essential that water conservation measures are implemented to protect the vital resource and to sustain life on Guam. I want to thank General Manager Berdalio, Assistant General Manager Chris Badassi, and the GWA staff for their support in developing this legislation. And I would like to thank my co-sponsors, Speaker Therese Terlaje, Senator Chris Barnett, and look forward to discussion and support Situas Masi. So this time I'd like to recognize Assistant General Manager Chris Badassi. Thank you for your patience.
Thank you, Madam Chair. Good afternoon, Senators Brown and Taitigui. Thank you for the opportunity to submit testimony on Bill 273-37. Our General Manager Miguel Berdalio submitted a lengthy testimony on the topic and covers quite a few things within that testimony, as well as an attachment of an affordability study that was done by the requirements of the PUC by GWA and its consultant in May of 2021. And that study goes into great detail as well about affordability issues on Guam and the idea of having a customer assistance program to assist with some of those issues. I'm just going to briefly try to summarize the General Manager's testimony. So to begin with, there's a great push nationally over the last 10 years and more so within the last 5 years by many organizations, mainly US EPA, the American WaterWorks Association, the Water Environmental Foundation, and they're all pushing to have these customer assistance programs implemented in various state and local utilities. And the main reason for that is because of the capital-intensive nature of compliance with the Clean Water Act and the Safe Drinking Water Act. And we went into that in great detail during the testimony of Bill 274 with the requirements that we need to be in compliance with both of those acts. US EPA also emphasizes that customer affordability and access to clean water is vital, and people shouldn't be, denied access to clean water because they aren't able to afford it. There's advocacy to tailor these customer assistance programs by water utilities and state and local governments, and so the idea is that you would tailor it to meet the needs of whatever it is in your community. So not all communities have the same issues, and so they put great emphasis on making sure that you understand the needs of the community and implementing programs that will help assist with those. So US EPA guidelines, the caps, they believe should all include discounted rates and bill payment assistance, and also leak detection services. And then, of course, there's the growing emphasis on equity and coordination with federal programs like LIHEAP and SNAP. And so I'll get into that a little bit more as I go further in the testimony. Looking at Guam's specific situation, according to the 2020 census, 21.8% of households were receiving SNAP benefits. So using that criteria, which would also likely be the basis for processing people who are eligible, that would be about 8,717 GWA customers that would be eligible for assistance. That analysis is also included, there's a similar analysis included in our 2018 Water Resource Master Plan update, and it also emphasizes that the amount of investment that we need to renew our system and to be in compliance with these laws places a huge financial burden on the residents of Guam and our customers. US EPA uses a threshold of about 2% of median household income to establish that communities would face or be considered a high burden in terms of financing regulatory compliance for wastewater systems. So as part of the 2018 master plan, Brown and Caldwell used an informal affordability benchmark of 4% for both water and wastewater. And based on that study, they showed that Guam would be upwards of almost 7%. Just a few examples of needs for assistance. There's a lot of challenges that are faced by our customers, some of which would be their employment situation. Maybe they're unemployed, maybe they're making minimum wage. There's also a lot of elderly people on fixed incomes, and then there's also the issue of private side leaks. So the utility is not responsible for any leaks that occur after the meter on the private side. And a lot of times what ends up happening is somebody gets a bad leak, they don't realize it until they get their next bill. So it could be 30 days go by and they've had this bad leak. Their bill might go from $100 up to $600. And so if you're on low income or fixed income, it's hard to pay that bill and hire a plumber to respond to that leak and get it repaired. And so leak detection and repair services are something that we believe should be part of any customer assistance program. GWA envisions providing bill discounts for customers on the volumetric portion of their residential bills. So the lifeline rate would stay the same, and then on the next tier where we charge a volumetric rate, we would provide a discount to that. Could be 20%, could be 30%, just depending on what kind of funding would be available. But it should be somewhere in that neighborhood to have a true impact to assist lower income customers. Leak detection and repair services, as I mentioned, are critical to break that cycle of high bills, broken payment plans, disconnections, and then eventually an accounts receivable charge-off. GWA is also considering assistance to all customers by providing rebates for installing water conservation measures or bill relief for rapid leak repair. So another way we could help all customers is, give them an incentive to get their leaks repaired quickly. So if we were to be able to maybe discount their bill 50% when they had that high bill from the leak, when it goes from $100 to $600, if we could cut that bill in half for them, if they get that leak repaired within 30 days, that's another example of a program that you could implement for our customers to be able to afford the opportunity to have relief on their bills. Now, as far as cost and funding sources, we're estimating the cost to be about $5 million, and that comes in the form of, for administratively qualified bill assistance, that would be the volumetric discount on the second tier. It would be about $2.2 million for those 8,700 customers. So the residential bill in 2025, based on our 5-year rate plan, would be approximately $90.57 at the 5 kgal mark. If we apply a 30% discount to that rate, then the monthly discount for that bill for those customers would be $27.17. And then if we extrapolate that out, that's where we get the $2.5 million associated to that. And that represents about 45% of the $5 million that we're estimating the program to cost. The next item is for supplemental bill assistance. This would be assistance to somebody that has some kind of an event that occurs that prevents them from being able to pay their bill. Perhaps they lose their job, perhaps there's a death in the family, there's medical issues. We would maybe have a cap and provide them supplemental bill assistance of maybe up to $200 or $500, and that would account for about 15% of the program costs based on our estimates. And then there's household water audits and water conservation fixtures. We're estimating those to be about 9%. So what would happen is on a monthly basis, we would put out alerts to our customers, which we already do, if they have a leak. We would offer services to have somebody come in and do a water audit at their residence if they wanted to, and then we would provide them, ways that they can help conserve water, and also the ability to have water conservation fixtures installed in their house if they are a low-income customer and they are eligible. I do want to point out that for the leak repair and detection, we haven't decided on how it would work, but we envision that GWA would repair any leaks from the meter to the house on the outside of the house, and then we would engage with private contractors to be responsible to do any leak repair within the house. And so that is how we are kind of envisioning the leak detection and repair portion of the program to work. And the leak detection and repair portion of the program would account for about 16% of the cost, estimated cost. And then there's program administration would account for about 10% of the cost, and that would be primarily for fees to whomever is going to help assist us with program validation. It could be public health, it could be department administration, and it would be for any other incidental things that we needed, whether it was supplies or public relations, communications to the customers, things of that nature. And then 5% of the cost would be to set up some kind of a data clearinghouse. So whomever we work with to have eligibility, we would like that to be done in an automated fashion, to have our systems talk to each other so that it could be a very smooth process and our customers could be taken care of in a timely manner. So overall, that accounts for the 100% or the $5 million estimated costs. And then, of course, the funding source in the bill is for grants and legislative appropriation. And I just want to point out, you know, there was a program set up by the federal government during the pandemic, and it was similar to the LIHEAP, but it was for water customers. And unfortunately for Guam, that program only gave us about $201,000, if I'm not mistaken. And it's not a permanent program. The LIHEAP is a permanent federal program that provides assistance for low-income customers. The program that was set up for water customers, it's not a permanent program, and there are attempts to have it that are happening in the states to have it be made a permanent program, but to this date, it has yet to be made a permanent program. And so that's why we believe it's really important that if the legislature passes this law, that they do provide a permanent funding source for this program, because there needs to be a reliable funding source to ensure continuity of assistance for years to come. And in addition to that, the investment that's being made in the water infrastructure and wastewater infrastructure over the next 5 years alone is going to generate approximately $44 million in business privilege tax. In addition to that, it's going to generate withholding tax, it's going to generate income tax. All of that tax and all of the revenue associated with those projects is going to circulate in the economy multiple times, creating yet more revenue for the government of Guam. And so, you know, the investment that's happening by GWA and the ratepayers into the economy is providing a lot of tax revenue to the government of Guam. And we believe that, you know, providing a permanent funding source for this program, using some of that money that's coming back to the government is appropriate. And we would ask that, you know, the legislature consider that. So in conclusion, the national trends underscore the importance of implementing these customer assistance programs. You know, we believe they're vital to ensuring access to basic water services for all residents. Reducing the leak expenses benefits all customers and GWA. So, you know, if a low-income customer gets caught in a cycle of they can't pay their bill, they have a leak, the bill keeps building, eventually they get disconnected, GWA ratepayers are paying for all of that. They're paying for the water that's being lost, that's going through the meter to the customer, and they're paying for the write-off because the customer can't afford to pay that bill. And so having a program to help with that will ultimately save money for the ratepayers. And then again, lastly, we're appealing to you to have sustained funding to uphold the CAP's mission should this bill be approved, and also the affordability and the access. By funding the CAP, you're reducing the burden of all GWA ratepayers to bear that burden of the account write-offs. So thank you. I'm open to any questions you might have.
Thank you, Assistant General Manager Chris. At this time, I'd like to recognize Director Byrne if he has any testimony on this bill.
No, Senator, not on this bill. Thank you.
Thank you for your patience. Okay, yes, so in regards to affordability, I understand US EPA has these metrics, and so considering that, you know, water is critical to our lives, what has US EPA done to provide any kind of assurance that there'll be funding available to help with low-income communities? Do you see any particular grants in the near future that they're going to, or currently that they have, that would address this or be able to provide funding for this?
Yeah, other than the grants that were provided as part of the bill, I believe it was I can't recall which one it was, but it was one of the pandemic bills. That's the only program that I'm aware of that the federal government provides any assistance to water utility customers. I'm not aware of any other plans US EPA has. I know they are supporting making that grant funding permanent, but to this day it hasn't happened. The one way that US EPA does kind of factor in customer assistance programs into what they do, and this does affect Guam, and it is an important thing that we need to consider. You know, we have these large projects that are required to be done to comply with the Clean Water Act and the Safe Drinking Water Act. And an example would be the Hagåtña wastewater treatment plant. So that, to upgrade that plant to secondary treatment is going to cost, could cost hundreds of millions of dollars if the plant has to be relocated. So, right now we are appealing to US EPA to push that off for another 10 years because we can't afford to add that to the top of the pile of what we're already got in front of us. And they may do that, they may not. And one way that they do look at customer assistance programs is if you have one, they're more likely to push that project down the road further than they are if you don't have one. So the recognition of the need for customer assistance program within your community plays a factor in their decisions on what projects they're going to require you to complete and the time frame from which you have to complete them.
Yes, understood. And regarding to the American Waterworks Association and the Water Environmental Federation, where do they get the funding to pay for the customer assistance programs?
I know that those organizations, to my knowledge, don't provide funding for customer assistance program, but they advocate for them. And they're not the only ones. There's probably a half a dozen different organizations similar to AWWA and WEF that advocate for these programs. And they do a lot of research within their membership on these topics. And they're kind of the AWWA and WEF are the ones kind of working with EPA and kind of lobbying Congress to try to make a permanent funding source for this type of a program federally.
Yes, that's really important. So I know Attorney Law Judge Fred Harecki was unable to stay, but he said he's willing to open a docket for this particular customer assistance program. I know you've worked, this was required, the affordability study was required of GWA, and I believe that one of the outcomes was the developing a customer assistance program from that. So I guess the question is, how long does this docket, opening a docket of such, of this program, how long do you think it would take to implement such a program upon starting a docket?
It could take a few months, it could take several months. I mean, when we had our 5-year rate plan, it took 4 years to get the case through. And so that's an example of the process with our last 5-year financial plan. As far as the PUC's involvement in opening a docket, I mean, the bill is very clear, and it makes clear that the funding source shall be from grants and legislative appropriation, and then it basically says, and it shall include these things. So, to the extent that a program needs to be developed, I think that's already in the bill itself, and it's pretty clear. It would just be a matter of, getting all the details involved and locked down before we could move forward with that project. And I think we could do that and then bring that to the PUC for their review. So, I think on our side, we could get the rules set up and work with some partner, either DOA or public health, and hopefully get that completed within 6 to 9 months at the most, I would think. And then the docket would come right on the heels of that, and hopefully not take much longer, but yeah.
All right, thank you for those responses. I guess I'm going to open up to my colleagues for any questions. Senator Brown.
I just wanted to ask, how would we determine, if we were to put this in place, because some of the concerns we get from ratepayers, from middle-class people in our community, which many of us fall into, these subsidized programs that are there for people in need, and I don't think anyone's going to argue about the need for water because it's essential. We need it to survive. But how would WaterWorks determine, what the amount was in terms of the volume of water, so we don't end up with abuse in the program? Because if I don't have to pay for something, I might be less likely to be conserving, the water that I'm getting. But if I'm the one who's liable for paying the water, and I got a water leak in my house, and I'm ending up with a $700 or $800 bill, and we've heard many of those complaints come to our offices, those people are stuck with those bills, and they have to pay them. And so I think we just want equity where those that are able to take partake in this program don't abuse it either. So I'm just kind of curious, is there something that WATERWORKS can determine is a reasonable amount of water and that's not excessive and it's not being abused?
I believe so. I think we could set caps based on the average household use, and I believe the federal poverty levels are set based on family size. So we could look at those kind of metrics. Say a family of 4 should use this much water, a family of 5 this much, and then structure it accordingly. So we could do something to that effect, I think.
Well, it'd be good to look at that because, again, as time is going on and we understand the need for these programs, but we also, not necessarily in this particular case because, this legislation is looking at implementing it, but there's just a general frustration with the working middle class that others benefit. There's all the, the pandemic, there were all these funds that were provided, but most of our people that actually were working middle class were not eligible for these programs, and yet they incurred the same level, if not more, financial burden during that time, and there was no benefit for them at all. And there's growing frustration somehow that we put in a lot of these social welfare programs, but there's little incentive for some to ever get out of it. And you've got those that are going through the grocery line that are counting, in their mind how much they're putting in their cart, and then they see others that are on these programs that can put as much as possible as they can fit into their cart. There's certain days of the month they don't recommend you go shopping because you're probably not going to find much left on the shelf. And while it's not a nice thing to talk about because people think, oh, you're not being very caring, at the same time, I don't like putting the adverse burden on those that actually have to work to pay for all of this. Because this is coming from somewhere. And if it's coming out of a legislative appropriation, then it's money that's not being provided to other essential needs in the community that a broader number of our population would benefit from. So like I said, I see the importance and the need for this because I think it's, as we know, water is essential. Clean, safe drinking water is absolutely essential. But we also want to ensure there's no abuse in the program because I'll tell you, those that have to pay, and then looking at the legislation earlier to address the authorization for GWA to go out and borrow, an astronomical, those are, back in the day, $200,000 or $300,000 bonds were really a large, humongous amount. When you're talking at 800 million plus, and something that the ratepayers are going to look at an immediate 5-year increase that they're going to have to be burdened with, that just compounds the frustration because it's already as a result of this pandemic. Anything and everything is getting more expensive. Eating is getting more expensive. When you look at average lunches, at $19 to $20 if you go out to eat, and that's lunch. Yep. Doesn't include all the other, household needs that people will have. We just need to ensure that there's fairness and equity and more importantly, no abuse of these programs, particularly in this case. Just so, again, if the working public has to carry the burden, I think they just don't want to see the abuse of others that are not even having to contribute for whatever reason, for these benefits that they're receiving. So I don't have any questions. I think you've outlined what those positive. I did want to ask one thing because you mentioned that GWA is looking at addressing from the meter to the to the wall of the house. Historically, it's always been GWA is responsible for everything from the meter out. Everything from the meter in on a private property becomes the responsibility of that private property owner because the odds are maybe I have a water leak between my water meter and my house that I wasn't aware of for a month or two. Right. And then I end up with this huge bill. It's always been the burden of the property owner to pay that. And so what are you looking at now in absorbing? Are you looking now at absorbing that responsibility?
Well, it would be part of the leak repair and detection program for low-income customers. So if you qualify for the program and you have a leak between the meter and your house, then we would come in and make that repair. And the reason that we're considering is because we think we can do it at a lower cost and quicker than it would be to have the private sector handle that. And then there's no issues of liability of entering someone's household, things of that nature. So that's why we were looking at doing it.
And for this particular program, because I'll tell you, we just had, not too long ago, a couple of faucet changes outside, exterior faucet changes. The bill's like $150. Yeah. I'm going to get that wrench out and learn how to do it myself. I'm just giving an example. I mean, it's not, as you mentioned, for private plumbing services, it's very expensive for people to get that. So, okay, I just want a clarification with regards to that because, like I said, historically, the policy has always been from the meter out. That's GWA. from the meter into your private property is a private property owner's responsibility. So I appreciate that clarification.
Yeah. And I'd just like to add, I very much appreciate what you had to say, and we will make every effort to make sure that, there won't be abuse of any of these programs. That's also why we're considering, from an equity standpoint, if we did allow for rebates for water conserving fixtures to be installed for all customers, and then similarly have some kind of a fast leak repair discount for all customers. So it does extend the program out to everybody and not just the low-income customers. So those are two ways that we could do that.
I think that would be very much appreciated by the consumers, especially as they're going to be. If we pass this legislation, in GWA, you don't really have a choice. You're up against the wall. If you don't address compliance, the federal government's going to fine you anyway. So the money's going to come one way or the other. But I think, like I said, I think there are a lot of hardworking middle-class people that are just trying to get by, and they're barely getting by with all these additional increases, and yet, they see the benefit of others that have nothing to contribute or very little to contribute to the table, and they're benefiting from it, and the hardworking people that are contributing to the process and are paying for all of this, there's no benefit, and they're only, all they see is more burden and more costs coming into their household, and they have less buying power. And unless you're getting $20,000 or $30,000 raises every couple of years, they're out of luck. And that's the majority of the people out there that's working in this community to keep things moving. So certainly anything that WaterWorks can put forth in these programs that they can see some benefit in participating in, and give them an incentive also, like you said, for water conservation, other things of that nature, I think that kind of relief would be much appreciated.
Thank you.
Okay, thank you so much. Thank you very much, Madam Chair.
Thank you, Senator Brown. Senator Tadegui, you're recognized.
Thank you, Madam Chair. Good afternoon, gentlemen. Thank you for being here, Mr. Burns, Chris. Who created this table of contents, 64 pages of this? How was it formulated? Was this something that you created, or did you pull this out of the
affordability study? This was a study that was done by GWA's consultant, Gallardi and Rothstein. So back in 2020, when we first brought our 5-year financial plan and rate case for the period 2020 to 2024, the PUC required us to do 7 analytical studies before we could move forward with the rate case. And one of the studies they required of us was this affordability study.
Okay, that being said, it looks like something that should go through a AAA process if you're going to create this rules and regulations, or this program that's all set to provide that feedback from the customers. And it was like deja vu, because I went to the good author of this legislation and said, "This looks like deja vu." She goes, "Yes, it was introduced in the 36th Guam legislature." And so sure enough, I did remember that. However, I think, the process of how this program should go, I think should go through some type of public hearing, outreach and hearing what the public has to say. So I will talk to the author of the legislation to incorporate some type of public hearing like we do in the AAA process.
GWA would not be opposed to any of that.
Yeah, okay. The other question I had, I just have a quick question with regards to water on Tidsen. Those houses that are up in Tidsen, do they receive free water, or they don't?
No, they do not. So the majority of them are metered, but there are still a few that are on what's called a flat rate.
Flat rate.
Because we're unable to get a meter into their residence, they're charged at a flat rate. And that flat rate is determined by the PUC, just like all the other rates.
I see. Does that have any effect on, certain other areas that don't have that type of metering, or, you're transitioning the military housing that were given back to the government of Guam, and if they're not on that, how do you assess that?
Well, there was there's a couple other
houses up in APRA.
Yeah, I think Schofield Heights was one of them, but I think that one is metered now.
Oh, it's already metered in?
I think so. I think
so right now,
only Tidsen, there's only a few that are not metered.
So the only one is Tidsen right now. You've covered everything else.
I believe so, but I can get you a report. I can send it to the committee that outlines all of the flat rate customers, like where the locations are.
And this is going to estimate cost about $5 million, and after about a certain amount of years, it'll be about $6 million, correct? Based on
These are
the-
just estimates. So, I mean, what could end up happening is we implement the program. Maybe there's $5 million of money appropriated up front. Let's say the first year we only use $2 million.
Okay, great.
Then that would just
Depending.
carry over to the next year. And at some point, we would, hope that the legislature would kind of replenish that fund as it gets down lower and lower. And so at this point, it's hard to say what it'll look like, but it could be lower, it could be.
I seriously doubt that. I mean, with the way the cost is going up and people can't even afford to live on this island, that we're having a mass exodus of those who are leaving. And when that happens, there goes our tax base, there goes the ability even to fund programs such like this because we don't have the population or, the tax base to support it. So we're seeing a great amount of exodus. So I think that needs to be incorporated when assessing this, moving forward. And the AAA process, as I mentioned to the oversight chair, to have an outreach program to the community and hear what they have to say. In every walks of life on this island. So thank you again, gentlemen. Oh, yeah. I do have a real quick question, sorry. My father has a house in Barragod Heights. It's empty right now because we're trying to sell it, and it's been like that for the last, almost a year now. And I'm noticing the water bill that I receive is like $63 a month, and it's sometimes $66, sometimes, and nobody lives there. Nobody using the water or anything. I have neighbors who constantly watch it. But why am I getting paid $63 for not even using water?
If the house has water and sewer, there are flat rates or base rates. So there's a base rate for water, which is, I can't recall the exact amount, but it's maybe $25, $26. And then your sewer flat rate is, I think, $27, $28. So the combination of those flat rates, so you get charged those whether you use 1 drop of water or a certain 5,000 gallons of water. So that's the majority of it. And then there's a legislative surcharge, I believe, attached to part of it as well. Okay. But if you'd like, I can work with you to try.
Yeah, absolutely. I have copies of it. Okay. That's it, Madam Chair. Thank you.
All right. Thank you, Senator Tadigui. And so being that there are no further testimonies or comments on Bill 273-37, this bill is duly heard. The committee will continue to receive written testimony until 4 p.m. Wednesday, May 8th. Please address all testimony to Senator Sabina Flores Perez, Chairperson of the Committee on Environment, Revenue and Taxation, Labor, Procurement, Statistics, Research, and Planning, or it can be dropped off the mailboxes here at the Guam Congress Building or emailed to office@senatorperez.org. So we just have one more bill. Thank you so much, Assistant General Manager Badassi, for your efforts and time. At this point, we're in the last item of the agenda, and we are going to hear testimony on Bill 272-37, COR, sponsored by Senator Sabina Flores Perez, co-sponsored by Speaker Therese M. Terlaje, Senator Chris Barnett, Roy A. Bicanata, Jesse A. Lujan. It's an act to amend 5252 of Chapter 5, Title 5, Guam Code annotated relative to modernizing the retention and dissemination of the procurement record and promoting transparency and efficiency in government. So just opening remarks, Bill 272-37 aims to update the current law by clarifying that agencies have the option to provide procurement records in a portable document formats, or PDFs, that can be transmitted electronically in the place of hard copies. Current law predates the widespread use of the internet and subsequent technological advances. Moreover, agencies continue to provide paper copies of procurement records upon request, despite widespread use of electronic communications. Needless to say, electronic copies will enhance efficiency of dissemination and retention of procurement records. Government agencies are required to retain procurement records for a minimum of 5 years before they can be disposed of, resulting in the need for storage accommodations to house records, many of which are hundreds upon hundreds of pages of communications, specifications, certifications, and other documents relevant to procurement. Bill 272-37 could potentially lighten the arduousness of exclusively maintaining hard copies and lessen the waste and the cost of exclusively providing hard copies to each request of a procurement record. Bill 272-37 also authorizes to establish a process to encode searchable PDFs to facilitate their review, which promotes transparency of expenditure of government funds and taxpayers' dollars to ensure a fair and ethical process. I want to thank my co-sponsor, Speaker Therese Terlaje, Senators Chris Barnett, Roy Abicanata, and Jesse Lujan, and I look forward to further testimony and support. Situas Masi. So at this time, I would like to recognize Director Byrne for his testimony. Thank you for your patience, Director.
Thank you, Madam Chairperson. Very simply, DOA would support this bill. In our new FMIS system, everything is in a PDF format. So everything is currently being stored in that way. I can't speak for other procurement functions throughout the government, but as far as the GSA and DOA is concerned, it's already in that format. With respect to fees, my only comment is we did have an issue yesterday where we were trying to transmit a file to, I think it was a FOIA response, a file, but it was too large to be transmitted electronically, so we put it on a thumb drive, and we may have to have a fee scale for thumb drives. We didn't, in this particular case, charge for anything because it was a one-off. But if it was going to be a significant expense, then we would want to do that. Up to now, I believe the Attorney General has required submissions under 5150 to be in paper form and large files, and we would certainly encourage any recipient, including him, to accept the submission in PDF format. But we're very happy with a provision that we can store and transmit these documents electronically. Thank you.
Yeah, thank you. Thank you for your testimony. So again, this bill would just basically expand the options, so it wouldn't prohibit the request for paper copies, but I suppose it would still require additional cost, perhaps. So yeah, just because I think, the reason why this bill was actually created is because one of the agencies wasn't, they were actually producing hard copies and wasn't clear on whether to use electronic transmission. So this basically just hopefully assures these agencies that they can still, they're within the law to provide electronic copies. Do you have any issues with the, for instance, I know PDFs is specifically mentioned, but I know technology changes, and I'm just wondering if you think this is too overly prescriptive a reference, or do you have perhaps alternate phrasing instead of PDFs?
No, I think that's fine. PDF is a generally accepted format. One of the things to recognize about PDFs is if you're trying to compress the file size, like to zip a file, PDFs generally don't compress very much, so you don't achieve much saving. But everybody uses PDF. I think almost every application you come across can read a PDF, and I think everybody understands what a PDF format is.
Okay. And do you foresee any issues with creating a searchable PDF format?
No. There are programs that do that. Sometimes when you try and do it, you end up with an unreadable document. But I think as we've gone down and we use more modern software, generally it's pretty easy. In fact, you can generally just click on the PDF and it does a word conversion.
Okay. All right. Thank you for those responses. I'm just going to open up to my colleagues for any questions or comments. Senator Brown, you're recognized.
Thank you, Madam Chair. I don't have any questions with regards to the testimony or this bill at this point. Thank you. Thank you to the Director for being here.
All right. Thank you, Senator Brown, and thank you for your patience too as well. Senator Tiedegree. Okay. So at this point, there's no further comments or questions. but the committee will continue to receive written testimony until 4 p.m. Wednesday, May 8th, 2024. Please address all testimony to Senator Sabina Flores Perez, Chairperson of the Committee on Environment, Revenue and Taxation, Labor, Procurement, Statistics, Research, and Planning, which can be dropped off at the Guam Congress Building or emailed to office@senatorperez.org. Being that there are no further testimony or comments on Bill 272-37, this bill has been duly heard. And thank you so much, Director Byrne, for your testimony, and have a great day. So at this time, the committee will adjourn. The time is now 1:38 p.m. So do as Masi, and have a great weekend, everyone.